Hi, my name's Teagan Lowe. For assignment 3A, Psychology of Wellbeing, I'll be focusing on the social issue that is eating disorders. In this presentation, I'll be giving an overview of eating disorders, the differing types of eating disorders, societal factors impacting and influencing eating disorders, a few of the warning signs to watch for, the effects of positive psychology on eating disorders, prevention through the means of positive psychology, and I'll be finishing with the intervention that I have created and will be adopting for this particular assignment and also assignment 3B. So, an overview of eating disorders. They are a psychological condition or disorder, which once were just considered to be medical or clinical. They are a mark of obsession and perfection with food and body image. Eating disorders have a high rate of comorbidity, which means they're tied in with at least one other disorder. Usually these are depression, obsessive compulsive, and a lot of people suffering eating disorders have a strong link back to anxiety. They have low self-esteem as they pursue perfection. Eating disorders can be caused by a myriad of factors, so genetics, a career selection, different cultural influences, and more recently, it was proposed that the brain structure and biology could also play a factor on eating disorders. There are a variety of types. These could be anorexia, bulimia, binge eating disorder, restrictive food intake disorder. But for this presentation, I'll be focusing just on the three most common, which are anorexia nervosa, bulimia nervosa, and binge eating disorder. I believe the principles of positive psychology will have a great benefit on eating disorders, which is why I've actually chosen this social issue to highlight and focus on. Anorexia nervosa is a psychological fear of gaining weight or becoming fat. Someone suffering from this psychological condition will technically be underweight, usually, and yet still have an unbalanced fear of gaining weight. It's a psychological disorder and not a means of dieting, and that shouldn't be confused. It's typically more common in women, but does affect both genders. Denial is a major factor of anorexia. It can be known as a slow death or slow suicide, and there are two distinct veins of anorexia, a restricting type and a binging type. And it does present cognitive and behavioral symptoms. Bulimia nervosa, on the other hand, there is a need to rid body of calories, so the purging, and there's a purging cycle. People suffering bulimia nervosa may secretly binge eat. There is an obsession with exercise that can develop as another form to burn calories from the body. So there are two types of bulimia, which is the purging, ridding the body, so via means of laxatives or vomiting. And then there's also the non-purging, which can be the obsession with exercise. The cycle of bulimia is quite strong. It starts with shame of one's body, which leads into strict dieting, which then causes the body a lot of tension. From this tension, they do crave from withdrawals and all the nerves that are in the body. Then they will binge eat from this lack of food and the cravings. Then they will purge to avoid the weight gain and then go back to being quite shameful of their own bodies. Binge eating disorder, it finds the person eating large quantities of food even when full. They tend to eat faster than the norm. Someone with a binge eating disorder will also like to eat alone to avoid humiliation in a social setting. And a sense of feeling ashamed or depressed or even guilty after overconsumption of food is quite common throughout this disorder. It's often described as an overwhelming, out of control obsession with food. And those suffering do not or are unable to purge themselves of the high caloric intake, unlike those suffering from bulimia. So, societal factors impacting and influencing eating disorders. There are definitely peer and parental influences, general focus of high achievement or perfection, societal obsession with dieting, societal obsession with excessive exercise or cult-like exercise programs, which we do see a lot in our day and age. Career factors, so choosing a career such as being a model or an athlete, dancer, and these sort of career types typically aspire and require a person to be a certain shape or aesthetic to be deemed successful in their career. Sociocultural norms and averages in differing societies and cultures, so it really sort of depends too on how you're brought up, where you're brought up, and what is typically the average. Media pressure and exposure is also a big one in this day and age, particularly with social media, but also covers TV, movie, magazines. Some of the warning signs of eating disorders are unhealthy periods without food, noticeable presence of anxiety around food, a person weighs themselves each day, thinning hair, extreme weight loss, severe mood fluctuations, overeating or binging, obsession with exercise to the point of excessive obsession or preoccupation, preoccupation with food, multiple frequent bathroom visits, frequent laxative use, or obsession with self and others' body image. The effects of positive psychology in eating disorders. So eating disorders have always been difficult psychological conditions to treat, and positive psychology in eating disorders should shift the focus to a creation of satisfaction with oneself, one's body, positive ideas and relationships with food. Education engagement is really, really important to educate oneself on conditions. And there should be a sense of self-accomplishment from taking positive control. More recently, interventions in this field have been moving towards the impact an eating disorder has on someone's life. Positive psychology seeks to identify 3 pillars, and these are individual, subjective, and group. And in this intervention that I have adopted, I sort out the trait of the group situation, which would have positive institutions for the purpose of emphasizing the factors. General prevention through the means of positive psychology. It's important to see a professional, ask for help, forgive yourself, listen to body cues, remove diets, avoid categorizing foods, learn about the disorders, try not to self-criticize, and if you witness or experience someone else with an apparent eating disorder, express concerns in a forthright, caring, and compassionate way. Now, this is the positive psychology intervention PIP that I have created and would like to adopt for both this assignment and for assignment 3B. PIP would be conducted in a group setting, thereby being less clinical. Peer support and communication is promoted through this intervention. The PIP intervention would facilitate conversation, which is similar to that of CBT, a branch of CBT, which is DBT. Positive psychological intervention, PIP, would be employed over other psychological therapies or treatments, as it would be used to challenge unhelpful beliefs and in the case of eating disorders would prove to be quite effective. I would conduct this intervention over 12 weeks to see its benefits. There would be a group of 8 to 10 and they would be encouraged first to discuss and be open with the group as they wish to feel more comfortable. The group would be prompted to employ mindful activities such as meditation, creative expression, or journaling, both in the group setting and as an individual at home. The goals of the intervention would be to encourage a healthy view of self and others, employ a healthy approach and balance to food and exercise, try not to self-criticize, ask those to be patient with themselves and others, and the biggest one is to probably start and maintain a food diary. Potential limitations of this intervention and adherence to the program is quite important to note. Some may start and be very, very enthusiastic to start, but it's their adherence and goals throughout that will really see the benefit of this program. But I understand this could be a limitation. A willingness to participate in the group setting and be very open to discussions and vulnerable. So that's also important. Someone may not feel comfortable discussing these things, and I would wish to set up a environment where they do feel comfortable to do so, but I understand again that given the individual that this could be a limitation. Another limitation of this is the selective or chosen field, society, or career of the individual. For example, a ballerina or a dancer has to be technically classified as underweight with a standard BMI of under 19, which is extremely low and is dangerously underweight. However, for that chosen career field, that could be a limitation for this intervention to see results. So that is my presentation. These are my references, and thank you very much.